And the irony of life is that it always seems like it's a good news and a bad news situation all at the same time. Less than a year after the deadly China coronavirus was unleashed onto America and the world, prompting government shutdowns and the destruction of the economy, not to mention destruction of lives, the American ingenuity came up with a vaccine in record time. In fact, it came up with 3 and possibly a 4th in less than a year. That's the very good news. Now the very bad news. Under the normal course of distributions, it will take 3 years for every American who wants to be vaccinated to get one. And here in Maryland, it may even take 5 years. This is how screwed up the system is. Mike, the county blames the state blames the federal government, and everybody seems to want to blame President Donald Trump. And how did we snatch defeat from the jaws of victory of coming up with a vaccine?
Well, I think part of the challenge was that nobody really put a master plan in place. So you look at, interestingly, there have been some stories as to why West Virginia has been so successful relative to how Maryland has operated. And the state said, here's how we're going to do it. Here's our plan for the state. And they didn't leave it up to every jurisdiction to do it. And they also recognized that they should use local distribution point venues like their local pharmacies to be able to distribute, to make sure you're getting into the communities themselves. So I think we have to go back and say, what is our overarching objective? And I think that Maryland and unfortunately Montgomery County have done a bad job of articulating what are our priorities, communicating those priorities effectively, and then really working hard to making sure they're getting the right populations. I can tell you right now what Fairfax, Virginia is trying to do, what the Commonwealth of Virginia is trying to do, which populations they're focused on. And I don't live in Virginia, I haven't been to Virginia in a month and a half. But I can tell you what they're doing because they're clear in telling people what they're after. I can't tell you what's happening here in Montgomery County, what our objectives are.
Well, Mark, I read an article in the Washington Post today about the way to game the system, how to game the system in order to get your vaccinations if you're that anxious to get it. I know I've signed up on 3 different websites already. I signed up on the state website, the county website, Giant Food website, Adventist Healthcare website, CVS. I mean, I've signed up on all of them. I've heard crickets. I've heard nothing. So well, how is this supposed to work?
So you're put into a triage, if you will, that then picks based on the criteria, prioritize who gets the vaccine when. And so as you fall out, as the scarcity of the vaccine is really the determinant here, when there's enough vaccine and your number is up, then you'll be able to get it. So maybe the good news is you're healthy enough that you don't need the vaccine as much as some folks who
oh no, Mark, I'm sick.
higher up on the list.
But
I'm old, Mark. I'm asthmatic. I'm a death's door. I need that damn vaccine.
Well, but that's the issue, isn't it?
But when I think one of the other important parts, though, is candidly, we don't have enough supply right now, and everybody knows we don't have enough supply. And so while there's huge demand because everyone wants it, the supply is still coming up. We're still building up to capacity. And so ideally, we're still in the very, very front stages of this. The jurisdictions are working out the kinks. The states are working out the kinks. The federal government, I think, is giving broader guidance now than they were before. And so as the supply continues to increase, I think, relative to what you were saying, it's going to take 3 years, I think you're going to start to see this really, really kick in another 6 to 8 weeks when we start to see that increased supply.
I mean, we all hear these anecdotal stories. I mean, yesterday on the radio, I heard a story about some guy in Virginia who drove 6 hours to North Carolina to get the vaccine because right across the border in North Carolina, they didn't care. And I've heard people who have gone to the states where their vacation home is, like in Delaware, and have been able to get it. I mean, wouldn't it be nice if we just had one registration and they would say, okay, you're going to get it in 3 weeks, or you're going to get it in a month. But at least it would take the uncertainty out of, and allow people to have peace of mind that they will get the vaccine.
Well, candidly, these are things I was surprised about at the beginning. The one thing we knew everybody was working towards, the federal government was making investment in, was a vaccine. So there was going to be a vaccine at some point, whether it was November, December, February, whenever. So if you know that part's going to happen, why wasn't there real focus on how we're going to actually administer that and put a system in place that provided a standard registry for everyone to go through? There was almost 9 months to do that.
Well,
so
in fairness,
is that
though,
the state that screwed up?
I was going to push back a little bit on that. I mean, in fairness, there is this issue, this trade-off of when people don't show up for vaccines, and that it becomes available for people who have, frankly, a lower priority, and better that the lower priority people have it than it goes to waste. So some states that have been more rigorous in, limiting to the scarce vaccines to a smaller group of people have found themselves in some hurt because people don't show up, and therefore they end up getting used. Whereas some states that were more flexible, you mentioned the North Carolina example, then they've been able to accommodate more people. So that issue of appointments is a real problem.
Well, we're obviously, I think the good news again is there will be a supply of different vaccines that will be available. And if we are diligent and patient, we'll all be able to get one if we want one. I mean, some people aren't going to want one. When we come back from this short break, after 3 weeks in office, how's the new Biden administration doing? Stay tuned for more of 21 this week when we come back from this short break.